Yeah, hi everyone. Once more, welcome to my channel. And I am here today to address a burning issue, that is erectile dysfunction or morning wood. So many African men do suffer from this condition, and a vast majority are ashamed to address the issue. They tend to associate it to their wives or a kind of accusation, whereas it is really a big pathological situation that has to be addressed. I can tell you that even men also face what we call infertility, but they will never accept it. They always accuse the women for being infertile, whereas they themselves also are in that condition. This erectile dysfunction, or call it morning wood, is quite common as from the age of 35. And if you don't address this issue, as you are growing older, things become more and more complicated. So I'm here to make this video to give you that courage and also find a solution to the problem. Those who are rich, they are able to see a doctor, or call it a urologist to be more precise, because this is something that can be handled by a urologist or an andrologist. It is all about what we call testosterone. While the women experience drop in estrogen, men experience drop in testosterone. And also some of the causative factors could be psychological also. The stress also. When stress builds up, you don't have that zeal anymore. You tend to suffer from what we call low libido. Now, you need to see a doctor, get yourself checked, and also make sure that your organs are functioning well. For instance, the human heart, most of the time, if your heart is not working, definitely that organ down there will definitely not work, because the heart has to pump blood around the body and it goes down to the organ down there. That's how it functions. So you need to look about that aspect as well. How is your eating style? How is your sleeping habit? Because you need at least 8 hours of sound sleep. If you remember, I made a video to explain sleep hygiene, that there are 2 types of sleep. You have the REM and the non-REM. So REM stands for rapid eye movement, and whereas the non-REM stands for non-rapid eye movement. So dreaming is another aspect. So if you dream more in 8 hours sleep, then I don't think you have slept, because that's the phase that involves the REM, or called rapid eye movement. The brain is still working. If they do you an exam of your brain, what we call electroencephalogram, you will see that there are some sharp peaks, meaning that your brain is still working while you are sleeping. So you are kind of dreaming while sleeping, which is not good and also unhealthy. So sleep is number one. If you can have 8 hours of quality sleep, that is non-REM, then that's a good news. Another thing is corticosteroids, or cortisol in your blood. The lower the cortisol in your blood, the more the body tends to function properly. So it's another way to assess your stress level. When stress is too high in you, definitely the cortisol goes up, and which is not good. Another aspect is eating habit. I have made so many videos to explain what to eat and what not to eat after the age of 35. I did explain the danger of consuming anything white. When I say white here, I don't mean white people. I'm referring to food. For instance, rice. flour. All those things, they contain high carbs and also hypercaloric. So they tend to spike what we call glycemic value of that food. So you need to be very careful here. In fact, I made a video to explain the danger of food with high glycemic indices and high glycemic load, how dangerous they are, like bread. So if you are someone who loves to consume such food, especially rice in the evening, then you are on the wrong track. You are going down the drain slowly and surely. So avoid rice in the evening for dinner. I would say take your rice maybe for breakfast or lunch, that's okay. But when it comes to things like dinner, I would say avoid it and avoid also all the flours. That's one thing. Another aspect is physical activity. That habit of sitting like washed potato at home watching television, it will take you to nowhere. I'm indirectly discouraging what we call sedentary life. Sedentary life is dangerous. You need to be active by going out of the house, engaging yourself in some activity, say bicycle riding, horse riding for those who can afford, swimming. Swimming also helps to reinforce the muscle and also create what we call hyperpolarization. When the muscles are hyperpolarized, the hormones, what we call the testosterone, tend to build up, and so that also helps in managing erectile dysfunction. So that's another aspect here. Then green leafy vegetable, that one I've said it so many times. Green leafy vegetable are highly loaded with nitric coxide. Nitric coxide is a magic substance. We call it scavenger. It helps to clear your arteries. For instance, you have people that at the age of 35, 40, they already have trouble with their arteries and capillaries, that they tend to have substances inside called atheroma or atherosclerosis, meaning that the tissues are no more flexible. They are hardening up. That's the meaning of that Latin word, atherosclerosis. So we need to see how to get rid of that pap-like substance, which we call plaque. When plaque builds up, the chances of you having stroke is very high. That's why I'm saying that you get yourself engaged by eating green leafy vegetable, because they do have what we call nitric coxide. And the nitric coxide function like scavenger in the sense that it clears the way. It trables your capillary, and so oxygen can get in there. You have an oxygenated brain, oxygenated tissues. So that's what I am saying here. If you are someone who loves to eat meat, I think you are not doing the right thing, because meat doesn't help in any way. No matter what the social media says, I don't encourage you to be eating meat at that age. I would say you might want to have a taste of fish, that's fine, but the principal substance here that you need to make sure you eat at least 3 times a week or green leafy vegetable. And the reason is because it has nitric coxide. Now, the question is, when I say green leafy vegetable, the next question comes in my mind is, how do you prepare this green leafy vegetable? That's a big issue here. They should not be overcooked. They should be prepared in that manner that we say al dente, meaning that they should be crunchy. The more crunchy they are, the more efficient they are. So if it is overcooked, then you are not doing the right thing. So make sure that the green leafy vegetable is half cooked. And also try to use your teeth by chewing, not just swallowing it or making smoothies. Smoothies, it might be done, but chewing it is of greater advantage here. So, bitter things, that's another one. Bitter things are loaded with tannic acid. For instance, bitter leaf, bitter cola. They are all rich in tannic acid that also help as an astringent. They go a long way by stimulating the pancreas, and that's how it helps also to create what we call insulin sensitivity. When the insulin is sensitive, it has a higher sensitivity, the more successful it is in the sense that it brings down your glycemic value. That's the main thing here, because if you are having issue with spike in blood glucose level or glycemia, then you are at high risk of developing what we call erectile dysfunction. So make sure that you consume green leafy vegetable like bitter leaf, and it should be half cooked. If possible, eat them raw. Cocoa beans, or what we call nips, cocoa nips. That one also is very important. You don't need to go far away to look for it. You just go to a nearby village around you and you can get it for free. I don't say eat one bucket, just 2 a day. 2 cocoa nips will do you a marvelous job because they contain some chemical substances in there that help to clear your arteries. That's why I'm encouraging you to eat cocoa nips. So just 2 a day is enough. If you cannot find that one, then bitter cola is another one. Maximum should be also 2, say 1 in the morning and 1 in the evening will go a long way. Talking about cocoa itself, it has a lot to do with cholesterol. It's very good in bringing down cholesterol because of the chemical substance that are inside, and also help to stimulate the liver to work properly. So that is the advantage. Now, another thing which I would say lengthy here is watermelon. Watermelon, beetroots. You can see for yourself the color, how they are all pinkish. Anything pinkish, make sure you eat as much as you can. Watermelon is loaded with arginine, to be more precise, L-arginine. L-arginine is a very good substance because it has part of the nitric oxide which I was just saying. So when you eat the L-arginine, it simply breaks down to release nitric oxide that goes down your organs to stimulate it for oxygen to get there, and that's how erection also kicks in. So eating watermelon and also adding, say, something like beetroots, they are all very good. Beetroots are loaded with resveratrol. Resveratrol is very good. That's why I tell you, if you can drink wine, red wine, they are loaded with this chemical substance inside. Very good for the human heart. Very good for people suffering from cardiovascular issues. Another aspect is black beans, not the red or whatever color. Black beans is also marvelous in the sense that it helps to slow down aging. Remember, I made it in one video to explain how we start undergoing aging after the age of 35. Things are not the same. When you were at the age of 16, some of us were able to jump across the gate, to cross the skip over the fence and or whatnot. But today, some of us are not able. So that's already a sign that aging is already on its way. So you need to find another way to slow down aging. And the only substance that you use to slow down aging is black beans. Black beans contain 2 substances, what they call the fiber. So the fiber, there are two types. You have the soluble and the non-soluble fiber. So black beans does two things. It helps to bring down cholesterol because it is loaded with soluble fiber, and the non-soluble fiber also goes a long way in creating that environment, making your stool consistent, and also help to slow down telomerase. Telomerase is part of the chromosomes that it slows it down. That's the length of it now. It doesn't shorten that faster when you eat black beans. But if you don't eat black beans, it shortens faster, and that's how it gives room for aging. So make it a habit of eating black beans as much as you can. I would say at least twice a week should be part of your meal. And pear. Pear also, it contains what we call glutathione. Glutathione is a good source of antioxidant. The more we slow down the antioxidant, the younger we remain. So that's my motive here by telling you that do not engage yourself in eating meat any longer if you are over 35. So that's the news for you. So ginger is another one. Ginger contains what we call alleine and allicin. They are all sulfur bridges. That's why most of the time I tell my patients who are having sinusitis and other, say, respiratory diseases that they should make sure they eat garlic raw, onion raw, because they all have that substance inside that endeavor them to respire. Because for blood to circulate around your body, there must be that way, that system put in place for this blood not to move and carry oxygen around this place. So you need those substances as well. Guava is another one. Guava is very good, even for women as well, because they are loaded with mineral. Your body needs mineral like zinc, because for you to stimulate the testosterone, you need to get a source of zinc. If you don't have any zinc in you, erectile dysfunction kick in very fast. So having zinc in your system slows down erectile dysfunction. So that substance comes from guava. If possible, chew the leaves as well. It will do you a great thing. So having said that, I will now give you a whole preparation now, how to prepare a smoothie for those of you having erectile dysfunction. So the first thing, it is bitter cola. If you can get one bitter cola, about 2 leaves for Bea Leaf, 1 beetroot, 1 slice of watermelon, and put it in the blender and blend it to make a glass of it, and take it one morning and one evening. You will see some changes. It might not be the next day, but if you keep doing it within a couple of months, you will see that things are not as they used to be. You will see some changes for yourself. So I repeat again, anything that is bitter, that has a bitter taste, should be in that container, in that your blender. Bitter cola. And then ginger here just acts as a stimulant, in the sense that it makes blood to run faster in your body. That's why I'm talking about adding ginger there. The garlic contains alleine for the sulfur bridges, and then the watermelon. Remember, I did say that watermelon contains L-arginine. The L-arginine now breaks down to give what we call nitric coxide. When you have more nitric coxide in your system, I don't see you suffering from erectile dysfunction. That's the good news. So go to the shop, the grocery stores, and get for yourself arginine. And also get what they call cocoa nips. That one, a farmer around you can offer you that one for free. You don't really need to buy it. So those are the things that you need to fight back this story of erectile dysfunction, which is taking place all over the place. So, excuse me. So far, so good. If there's anything that you've not understood, please do not hesitate to come back to me. Ask questions, as many as possible, and I'm here to answer you. Once more, my name is Dr. Wan. Share this video with anyone suffering from erectile dysfunction. Share it with your loved ones and even with your enemy. Do same. Remember, life is a gift and knowledge is another gift also. And I choose to do this for free. I'm not asking you to pay me anything. So that's it. Subscribe to my YouTube channel. Share it with everybody. Once more, my name is Dr. Wan. Thank you for listening, and I'm going to make part 2 of this video to explain further in terms of the dosages, the strength in milligrams, so that for those who want to buy it from shops in North America, they know where to go buy it. That's it. Thank you, and bye-bye.